everybody has kind of an idea or an assumption, I think, in their minds that acupuncture is something that's just this real quick cure-all. And when you sit down with people and as you've been treating people, you find out that everyone responds differently to acupuncture. And within that, you have some people that will respond immediately. That same day, they'll get off the table and be like, I have no pain. Or that stress or tension or tightness I was feeling is gone. And others will get off your table and they'll look at you and be like, I feel the same. So it's something I feel very important to address right away, that it's going to vary from individual to individual. It's going to vary based on what we're treating. You know, is this an acute condition? Is it chronic? You know, is this something that involves digestive issues versus mental health issues? Because everything is going to respond differently. So I like to tell people, you know, regardless of what they come in for, that we are going to shoot for a minimum of 6 to 8 treatments. You know, because that's usually the window that we fall into before we start seeing significant changes. And then we'll go from there. You know, and with that, the effects of the acupuncture are cumulative, so they're going to build in the body. So if we can keep those sessions closer together, we have a stronger effect. So if you can come in, you know, twice a week for that first 6 to 8 treatments, that's ideal. But of course, that's not always feasible with people's schedules, with availability. So even if it's on a weekly basis, you know, you're getting there at least once a week, you know, people generally will start to see improvements by that 6 to 8 treatment. And then from there, we can start playing around with it a little bit. You know, do you think you can get away with skipping a week or going, if you've been doing twice a week, once a week? And that tells us, okay, how long is your body adjusting to the acupuncture and holding those benefits? And then how long can we push out from there? And the goal, of course, is to eliminate the need for the acupuncture altogether. With some people, that's just not the case. You know, if it's somebody that has been suffering from chronic pain, and that whether it was an injury, whether it's, you know, arthritic pain, which we're not going to reverse, you know, it becomes slowing it down. It becomes more palliative. But with that, we can increase how good and how comfortable that patient is over a period of time where maybe they don't need to come in every week, every 2 weeks, maybe it's once a month, maybe it's every 3 months, you know? So it's different for everyone, and we'll address that with each person as they come in and see what works best for them and how their body responds. So it's definitely not a one and done thing. It takes some time, it takes some patience, and it takes commitment.